Does everyone know how to use the chat box? If you do, go into the chat box and type in yes. I want to make sure you guys know how to. If you know how to use the chat box, go in there and type in yes. Very cool. There's still more folks coming on here. Awesome. Okay. Very cool. I hear water in the background.
That's my cat's water fountain. I don't know why. It's very quiet. I don't know.
Feel free to mute yourself if you. There you go. I was like, "What's that water? Am I still in the wilderness?" Very cool. Okay, most folks here are familiar with the chat box. If you don't know how to use the chat box, go to the chat box and type in "I need help." Or never mind, that was a joke. If you don't know how to use the chat box, go in there and type in "no." I'm just kidding. Very cool. So how many of us here, and you can type in the chat box, how many of us here are feeling kind of cooped up at home? Type in the chat box if that's you. Yeah, okay, Karen, Amanda, Lynn, sort of, Elaine. Carolyn says not at all. Okay. Well, we know who's an introvert and who's an extrovert here based on this. Jack. Awesome. Mr. Durish says, not me. I've used this time to publish 2 books and have 2 more books coming. Amazing. Is your books on Amazon, Jack? Marilyn, no. I would love to see your books. I'd love to see what you've written with that. Print and ebook, yes, yes. I haven't. This is not the topic for today, but as you guys know, we are part of Alzheimer's Orange County. I was going to say Amazon Orange County, Alzheimer's Orange County. And if you are interested, I do have a book that's actually selling on Amazon, but I will send it to you at no cost. For if you're interested, just shoot me an email. It's a book on Alzheimer's risk reduction. I can send you the email. The ebook version of it for you guys. All you have to do is just email me. Let me put in my email here, guys. There's still more people coming on here at alzoc.org. Okay, take a look at your chat box and write down my email. I do have a book on Amazon risk reduction that I'll send you for free at no cost if that's an interest of yours, although it's not our topic of talk today. So, COVID, back to COVID. We are in a this what's called this second wave in the United States. How many of you guys have heard about this second wave, this coronavirus wave that we're in?
Me.
That a number of you guys have heard about that, right? Or read about it or watched it on TV. The second wave that folks are talking about here, that we're in currently. And what that means, guys, is that Amanda Osuna says, I'm seeing an upward trend in Arizona. Yes. What hospital are you at, Amanda? What hospital are you at right now? And so Amanda has a leadership position at one of the hospitals that she works at. And yay, she was one of my nurses at Memorial Care and moved up. So that's awesome. But we are Benson Hospital Critical Access. It's a slow increase. I'm at Memorial Care. Orange Coast Memorial, we are starting to see a slow increase in the number of patients coming in with COVID and ICU beds slowly creeping up. Although I must tell you guys that, and I want to congratulate you for those of you guys here in Orange County, our numbers continue to stay relatively good compared to what I'm seeing throughout the country. The Midwest, for one reason or another, is seeing a really fast rise in the Midwest. Europe is seeing a rise as well, and even the country of Israel closed down a number of weeks ago, and the entire country closed down because of their COVID numbers in Israel. So quite something. It wasn't something that we didn't expect. We expected it just like the flu. You know how when it gets cold, the flu virus comes out and the cold virus comes out. And we did expect COVID to peek its head up as well. And it's not disappointing us because it is creeping its head up currently. I want to chat with you about a concept that I don't know if many people have heard of. And that concept is called viral load. Viral load. Type in yes or no if you've heard about viral load before. Yes or no. Elizabeth, yes. Karen, no. Jack, no. Okay, I'm seeing a lot more no's. Good. That means I get to teach you guys something today, huh? Wow, I get to teach you guys something today about viral load. And once you understand viral load, you'll understand a little bit more about what we're learning about COVID. First thing you should know is this, this virus is a new virus. It's we've only got data since, January, February, March of this year. So it's been less than a year. It's still new to us. And every week something else comes out and we're learning, right? It's tough in the United States because we always want very quick answers. We want, quick solutions. We want rapid data. We want conclusions, right? Do I wear a mask? Do I not wear a mask? Do I do this? Do I not do this? We want answers today for a virus that's new, and so when anything new comes out, as you know, we are learning about it slowly over time, so that the information we have today may change tomorrow. It may change next week. And it makes us confused, and it makes us frustrated, and it also makes us distrustful. It also makes us distrustful because the data we have now may not be the final conclusion of what the facts are, what the truth are, because it's just part of something new that comes out as we learn about it, and as we collect more data and more research, our beliefs and our thought process evolve, and it's allowed to evolve with that. How many of you guys know and understand that coronavirus doesn't kill you? What kills you is your immune system's attack against the virus. Isn't that crazy? When I say that, it's like, what? Right? Let me say it again. Right? The virus doesn't kill you. What kills you is your immune system's response to the virus. Does that make any sense to anyone? Yes or no? You can say yes or no. And it's okay if it doesn't make sense because I'm going to explain it to you, right? I'm going to explain it to you with that. Ooh, you guys are good. Most of you guys, it makes sense too, huh? All right. Either that or you've been in one of my other lectures before where I'm spewing the same information out all the time, right? So, what is one of the first symptoms of coronavirus? Anyone know one of the first symptoms, one of the most common symptoms of coronavirus? Type it out. Type out one of the most common symptoms of coronavirus out there, guys.
Fever.
Let's see, fever, tiredness, cough. taste, loss of taste. Loss of taste is becoming pretty common, actually. Cough, 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 cough. Very cool. Yeah, let me look through all your answers here. I think based on consensus, fever probably has the highest answers here. Low pulse ox. Ooh, low pulse ox is there. It's not common. When it's common, basically, you know, is when you need to be hospitalized. Fever, yes, fever. Did you know that fever is simply your immune system trying to fight something, right? Let's say if you caught the flu, I see shortness of breath here. If you caught the flu, your immune system is fighting the flu virus, right? If you caught a bacteria, your immune system is fighting the bacteria. If you got a toxin in you, whatever it is, right? A fever is one of the first symptoms with that. Okay, fever, and what we are seeing, guys, is that it is also one of the most common symptoms of coronavirus, a fever. A fever is simply your immune system trying to fight something. It creates inflammation. A fever is inflammation, okay? When your body gets really hot, that's when you have a fever. And when your body gets hot, your body gets inflamed, right? Inflammation. So, am I making sense to you guys so far? Am I making sense to you guys so far? A fever is simply inflammation. Your immune system creates inflammation to fight against the bad guy, right? To fight against the bad guy with that. Now, how many of us had ever had a sprained ankle where you walked and you tripped over something, and in the first few minutes, you've had a sprained ankle or you sprained something before? Type in yes if that's ever happened to you. Type in yes if you've ever had something sprained, right? Elizabeth, Dorothy, Bonnie, Lefon. Okay. Let me ask you this. What is, in the first 5 minutes of that sprained ankle, what does that ankle look like? What happens to that ankle in the first few minutes after it's sprained? What happens to the ankle? Type down what happens. Swelling, 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 swollen. Yes, yes. Swelling, pain, redness, heat, right? And it sometimes turned black and blue later on. You are right, swelling. So anytime your body is injured, one of the first thing that happens is your immune system rushes to the area of injury to fight against anything that should not be there, right? It's trying to defend the body in that area of injury. And in the process of the immune system coming there to look for a bad guy, to fight something, or if you had a cut or a bruise or a laceration in your hand, right? It swells up, it turns red, and there's pain and there's heat, right? The immune system rushes over there to defend itself from the area of injury. And when it does that, when it's fighting something that shouldn't be there or an injury, the process of that fight is inflammation. And inflammation results in swelling, right? Inflammation results in all that fluid building up, causing swelling in the area. And so swelling from a sprain, swelling from, a cut or bruise is simply inflammation caused by the immune system. And has anyone had swelling in an area of injury before where it just gets really big and hot and inflamed, whether it's your leg, your arms, right? In that area. Now, that's simply the immune system doing its job, right? The immune system doing its job, going to an area of injury, an area of where something shouldn't be there, like an injury or an infection or things of that sort. Now, coronavirus. Where does coronavirus enter the body? In what areas does it enter the body? Type out. What area does it enter the body? Okay, head. What part of the head? How does it enter your body? That's correct. Nose, mouth, and eyes, right? Nose, mouth, and eyes. So if this is the only way that it can enter your body, right? It's really why we wear a mask, right? To protect it from entering that your body. Once it enters your body through your nose, your mouth, where does it go to next? Where does it go to next? Once it comes through here. That's right. If the virus sticks only here, if the virus only stays here, then it causes only symptoms that are up here, right? Kind of like a cold, right? Causes sputum and runny nose and kind of like a mild cold. If the virus only stays here, it causes a mild cold-like symptom. If the virus goes to your lungs, if the virus goes to your lungs and it sticks to the cells of your lungs, right? All the different cells of your lungs, where does the immune system go to fight it? Oh, we still got people coming in. Yeah. Your immune system goes to your lungs to fight the virus, right? If coronavirus gets to your lungs, your immune system goes to your lung. Holy moly, we still got people coming in the waiting room. Let me add them, right? When your immune system goes to your lung to fight the virus, I want you to imagine what happens to that swollen ankle when the immune system goes there. Remember that big ball of swelling in the ankle? The big ball of like debris and swelling and pain and redness and inflammation. I want you to take that big ball of swelling and bring that to your lungs. Okay? And if you have all that swelling and fluid accumulation in your lungs, what kind of symptoms are you going to have, guys? If you have that pool of inflammation, that's right, SOB, right? It's like son of a can't breathe, right? I can't breathe, short of breath. This is why shortness of breath is a symptom, right, of coronavirus. It's all that fluid accumulation from inflammation goes to your lungs. And what it's doing is that it is drowning your lungs. When it drowns your lungs, what happens to your oxygen level? Right? That's right. That's right. Your oxygen level decreases. This is why we admit patients to the hospital with coronavirus. Low oxygen level, right? Low oxygen level. And then we have to give them oxygen, right? And this is one indication of admission for coronavirus. Lack of oxygen. And now, do you understand now why oxygen level drops in your lungs? Do you understand now why oxygen level drops? Type in yes if you do. It's that pool of inflammation fluid. That pool of inflammation fluid due to your immune system trying to fight the virus. Do you understand now why I say that coronavirus doesn't kill you, but your own immune system does? Does that make sense now? Does that make sense? Right? Good, good. I wanted to explain that. Now, the medications that we have today, FDA approved for coronavirus. How many of you guys know what meds they are? If you do, type them out. If you know the meds that have been approved for coronavirus, type them out. If you know what they are. Elizabeth, good. Holy moly, we still got folks coming in here. Resveratrol, Lawton. That's from like wine, red wine, Lawton. Where'd you get red wine and coronavirus from with that? I like that though. I wouldn't mind a glass of red wine to treat my coronavirus, but it's not FDA approved. Not FDA approved. Remdesivir, yes, is approved. There's another one approved. Have you heard of a steroid? Dexamethasone. Have you seen that one before? Dexamethasone is approved for COVID at this point. Okay. So let me ask you this: why are we treating a virus with a steroid? Why are we treating a virus with a steroid? And why is it FDA approved? That's a methasone. Anyone know? Absolutely correct. Because steroids reduces inflammation, doesn't it? And so the FDA approved steroid treatments because we now know that it's the inflammation of your lungs that kill you. And by reducing the inflammation, reducing the swelling, the fluid accumulation in the lungs, that is why we treat it with a steroid, right? Dexamethasone. Is this making sense for you guys so far? Cool. Cool. Okay, good. I'm glad it's making sense. Because I'm trying to make the connection between what you're seeing, out of the FDA and why that is, right? It's like, why are we approving, a steroid to treat this? It's because it's the fluid accumulation that kills you. It's the fluid accumulation. We call it cytokine storm. Anyone heard of the word cytokine storm before? We use more than just steroids. Yeah. Cytokine storm, what does that mean to you guys? What does cytokine storm mean to you? I'm going to type it out here. Virginia says, can't even spell it. Yeah, cytokine storm is basically an inflammation storm. That's what it is. It's an inflammatory process, cellular response, right? The cells rush in to respond to inflammation. That's what it is. Coronavirus causes an inflammation storm. We call that cytokine storm. And all that inflammation rushes into your lungs and it floods your lungs so that you can no longer breathe. And it cuts down your oxygen level, which is why we admit patients to the hospital with COVID, because of that inflammation storm, that flood of debris, of inflammation that fills up your lungs and drown you. Right? And patients get admitted and they go to the ICU. They go on a ventilator because they get tired of trying to breathe, right? So the ventilator breathes for them. And with the hope that your immune system, your body will somehow over time, cool down the inflammation that's in your lungs, and that you can breathe again on your own. So that's the term of cytokine storm, okay? Inflammatory storm with that. Now that you understand inflammation and how COVID kills through inflammation, by the way, did you know that it's very rare that you would just die from only COVID alone? Most people who die from coronavirus, guys, die from a condition, from a weakness in your body that coronavirus exposes. So very rarely do you ever see on a death certificate COVID. You will see COVID on there, but oftentimes you're going to see congestive heart failure. Oftentimes you're going to see sepsis or lung failure or pneumonia, right? You're going to see other diagnoses on there besides COVID. So there's this big, argument that I see on Facebook all the time. Did somebody die from COVID or did they die from something else? right? And it's blamed on COVID, right? How many of you guys have seen that argument before on social media or from the internet, right? Did they really die from COVID or did they die from something else and it was blamed on COVID, right? Have you guys seen that on social media and all that? And here's the truth. They died from something else, blamed on COVID. But if COVID never was there, they would have never died from that something else. Does that make sense to you guys? For example, if I have underlying emphysema, right, COPD, COVID comes in, attacks my weakness, which is COPD. COPD is my weak spot, right? And it flares up my COPD. And yes, I will die from COPD, but caused by COVID that basically, flares up the COPD. If COVID was never there, I still would be alive with my COPD. Is that making sense to you guys? Hardly anyone dies from just COVID. It's usually it's usually a weakness in your body, right? If you have an underlying heart condition, lung condition, asthma, COPD, emphysema, if you have cancer and your immune system is messed up, right? If you have autoimmune conditions, whatever chronic condition you have, hypertension, obesity, whatever chronic condition you have, coronavirus exposes that weakness in your body and it flares it up. It flares it up and it kills you. That condition kills you, but driven by underlying COVID that exposes and flares up that condition. Joey Kelly says exactly what happened to my brother. Right? Does that answer the question for you regarding, are you dying from COVID or are you dying from a different condition being blamed from COVID? Does that clear up a little bit for you, that question? Because I see that question all the time, right? Now, if you're riding your bike and a car hits you and you die and you happen to have COVID, I can't blame that car accident on COVID, right? That's a bad, that's a bad thing to blame that on COVID, right? Virginia says, yes, but wouldn't it be better to say it's a COVID death for statistics? Sometimes, Virginia, both diagnosis is on there. You would see pulmonary failure or heart attack, and then COVID is on the second line of that diagnosis, right? I mean, I filled out a death certificate this past week. On a patient who died in the hospital. And so there's always a line number 1 on the death certificate and a line number 2 on the death certificate. The line number 1 is like, what did they die from? Like respiratory arrest, where they stop breathing. Line number 2 is often due to something, right? So it's really how the doctors fill out the death certificates on there. If all they filled out was respiratory arrest and they didn't fill anything else, then it's just respiratory arrest. Sometimes they'll write down respiratory arrest due to COVID. So these death certificates is what drives the statistics for deaths for COVID and things. So it depends on really what the doctor writes down. Sometimes they'll just write down COVID and nothing else. So we saw the CDC statement a few weeks ago saying only 8% of deaths are due to COVID, purely COVID, right? And all that means, guys, is that on the death certificates, 8% of those death certificates, the doctor write down COVID and nothing else. But many of us physicians, we don't just write down COVID. We write down heart attack due to that second line COVID, or we write down emphysema due to COVID. So it's really what the doctors write down on the death certificate is what drives that data with that. Now, let's go back to viral load, because many of you guys have not heard about the term viral load before. Let me type it down for you, viral load. By the way, How many of you guys here would take the COVID vaccine when it comes out? Type in yes or no. Type in yes or no. When the vaccine comes out, type in yes or no. I'm gonna see how many yeses versus no here. Barb says depends. What does it depend on, Barbara? You want to see how many people drop dead first, and then I'm just kidding. Jack says yes if once it comes out, it's approved right by the FDA. We got about maybe 50-50 here, guys. We got about not sure. Valerie, not sure. Valerie wouldn't be first in line for it because Valerie's going to wait for me to get it first to see what happens. Yeah. Jack Doris says, would I take it? So, so I'll tell you what I would do, right? I'll tell you what I would do. The first thing I would do when I see something that says FDA approved, right? The vaccination is now approved. For coronavirus, we have a vaccination now. The first thing I would do is I would go and look at the clinical trial myself. I would personally go and look at the data and the results of the clinical trial. I would check to see if it's double-blinded, it was done properly. I would look at side effects, right? Because that data is going to be pretty much public once it's out. I would review the data myself to see how the trial was done. So I think the Moderna trial that is being done right now, they're testing 30,000 patients, guys. They're enlisting 30,000 patients for this vaccine. So the first thing you should know is that I'm going to review the trial first. The second thing you should know is that I'll come back and tell you what I think about it. How's that? How's that for an answer? But I'll review the trial and I'll come back and let you know what I think about it. But you won't be first in line. For example, Moderna has 30,000 patients enrolled in this vaccination. 15,000 are taking the shots. Another 15,000 are the placebo group, right? Dorothy would check the preservatives first with that. And so there's at least 15,000 patients that you know who have gone and got their shots first in these clinical trials with Moderna. Okay. The other thing you should know about these vaccinations is that it's going to require 2 shots. It's going to require 2 shots. That's what I'm seeing now in the vaccination study. It's you get an initial vaccine shot, and around a month later you get a booster. That's what I'm seeing in the Moderna study and a few other studies. There's several phase 3 out right now. I don't know if they're all doing the same, but it's going to be 2 shots, not just 1. Okay, guys? You need a booster like a month later. And the whole idea of vaccination is what, guys? You're trying to build up what when you're vaccinating? What are you trying to build up in a vaccine? Anyone know? Immunity, antibody response, immunity. Yes. It's the same reason you get a flu shot, right? Melissa says, do you think we will end up getting yearly coronavirus vaccines like the flu? Melissa, it's an interesting question. And the answer depends on how long the antibodies last, right? How long the antibodies last. So if your antibody from the vaccine is going to last, for a year or several years, kind of like the mumps, rubella, the MMR, right? The MMR vaccination, the antibodies last forever, right? Your immune system remembers it forever. That's why you don't get yearly MMR shots for your kids, right? The flu shot, your antibodies only last for so long, which is why you have to go back for the flu shot once a year, right? Tetanus, how often do you need a tetanus shot, guys? Type in if you know the answer. How long do you need a tetanus shot? Do you know why it's 10 years? Do you know why it's 10 years? It's 10 years because the antibodies last that long, right? Your immunity remembers it for about 10 years. then you need a booster, right? That's how we come up with the frequency of these vaccinations. It depends on how long the antibodies and not just antibodies, but your T cells memory, right? There's this B cell memory from antibodies. There's T cell memories and immunity. So 10 is 10 years because your immunity remembers it for 10 years and then it forgets, which is why in 10 years you have to do another tetanus shot. Does that make sense to you guys now on the frequency of how often you need vaccinations? Right? Does that make sense now? It's for how long your immunity can remember it. Okay, good, good. So the question is, how often do we need vaccination for coronavirus? It's going to be the same answer for as long as the antibodies are there. Oh, we got folks coming in still, right? For as long as your antibodies can remember it, your immunity can remember it. So what that means is I don't quite know yet until the studies come out and we see how long it lasts. Now, something really interesting. There was a study published recently that did say that coronavirus immunity in this particular study, the antibodies lasted somewhere between 5 to 7 months. The antibodies lasted between 5 to 7 months. So I thought that was kind of reassuring that you get at least half a year of some protection, right? And the question Barb says is, how quickly does it protect you? It depends on how quickly your antibodies build up from it. I'm sure if you got a vaccination, today, and an hour later you're exposed to coronavirus, I'm not sure you'll build up antibodies that fast, Barb. But in general, with vaccinations, our antibodies does build up in over a few days, and it continues to build up with that. But the latest study shows that your antibodies do last for at least 5 to 7 months. Now, here's something else interesting. Virginia says, does somebody else's antibodies help you? Yeah. So Virginia, clinical trials are being done now where we are taking the antibodies of folks who have been cured from coronavirus, and we are the oh, all right. Am I still frozen?
No.
Okay, I'm good now. Okay, so one of our first physician here in Orange County who was hospitalized for coronavirus, he was in the ICU near death, and they found donors, plasma donors, and donors of antibodies, and infused their antibodies into him. I don't know if that's what helped or not. He did recover, but clinical trials are being done to evaluate that. Dorothy says, should someone who has corona get a vaccine after? If you did get coronavirus, I don't know the rules yet, Dorothy. With this, it's too early to answer. If it was the flu virus, I would say yes. It's like I got the flu, yes, I should get the vaccine the year after, right? If it was something different, yeah, hard to say, too early to tell with that. So anyway, these phase 3 studies, guys, are being done with vaccination, and we expect it to be ready probably by first quarter or something. Depends on who you listen to, right? The president thinks it's sooner, and the folks at the, I don't know, CDC thinks it's a little bit later. But in either case, it's going to come out with that. Elaine says, should you take the immune boosters? You mean the second shot? Yes, the second shot is part of the whole immune system. Or are you talking about something else, Elaine? Type that out. So oh, Judy, I see your hand raised. Do you have a question? You can type in your question, or you can just. Oh, Elaine says airborne. Okay, guys, if you are interested, there's two ways to protect you from coronavirus. Cindy says, if someone develops antibodies, can they get COVID again? They can only get COVID again if those antibodies go away. So if you have antibodies and it's there the rest of your life, then theoretically you're fine. If the antibodies last, for half a year or a year and the antibodies go away, yes, you can get COVID again with that, right? If your immunity no longer remembers it. All right. It's not antibodies. It's just one part of your immunity. There's also T cell immunity, guys, that also helps with your immune system with that. So one other thing that is really important, you guys, other than coronavirus prevention, which is, wearing a mask, social distancing, washing your hands, which we all know. The other thing that's really important is strengthening your immune system, strengthening your own immune system. How many of you guys know what to do to strengthen your immune system? Type in the chat box. What are some things that can be done to strengthen your immune system? Yes, exercise, very important. Getting enough sleep, super important. Did you know the lack of sleep messes up your immune system? Barb says, sleep well, eat well. Joni says, avoid sugar. Yes, sugar is pro-inflammatory, super important. Zinc, yes. Antioxidants, yes. Lynn, healthy living in general, love it. We don't have a whole bunch of time for me to tell you everything you need to do. But if you, how many of you guys are interested in a list of anti-inflammatory foods? Anyone interested in a list of anti-inflammatory foods? Okay. Let me see here. Okay, here's what we'll do. Shoot me an email and I will email you the list. Okay, I just posted my email in the chat box. Shoot me an email and said, Dr. Trinh, send me the list of anti-inflammatory foods. Because I rather send the list because, we got like 10 minutes left for you guys here, but I will email you a list of anti-inflammatory foods. Super important to, one, improve your immune system, two, cut down on inflammation in your diet, okay? Cut down on inflammation in your lifestyle with that. Elderberry. Elderberry does have data showing immune fighting properties. I'll tell you what I take at home. And this is just me, guys. I do some vitamin C. If you're eating a super healthy diet, you don't necessarily have to take a bunch of pills. Okay. I always believe that your food should be your medicine. Your food should be your medicine. But if if your diet sucks, I mean, you can always do some vitamin C. And zinc is something that has been shown to be something that helps with the immune system. I've seen D3, vitamin D, super important for the immune system. It's funny because when we think of vitamin D, guys, the only thing we think about is, bones. You got to take vitamin D for your bones and things of that sort. But we are finding out so much more about vitamin D. We are finding out that the lack of vitamin D increases your risk for Alzheimer's disease. We are finding out that the lack of vitamin D decreases your immune system strength with that. What is the recommended dosages? Recommended dosages of vitamin D, zinc, vitamin C. The vitamin D dosage, guys, depends on your vitamin D level in your blood. Did you know that you can simply get a blood test to look at your vitamin D level with that? Did you know that you can simply get a blood test to look at other levels as well, right? Magnesium, zinc, other vitamins and things of that sort. Um, but vitamin D recommendation all depends on your levels. Elaine says, if you have an autoimmune disease, should you not boost? If you have an autoimmune disease, it's even more important to lower your risk for inflammation. If you have an autoimmune disease, which is driven by inflammation, right? Inflammation drives the immune system and autoimmune system problems. It's even more important to lower your inflammation through diet and things of that sort. Virginia says there's C in so many supplements that my doctor took me off regular C. Yes, hydration is important. Taking too much of any vitamin, guys, is not necessarily a good thing. With that, you can overdose on certain vitamins, especially the fat soluble vitamins. The water soluble vitamins, if you have too much of it, you will simply pee it out, right? I always tell people that in America, we have the most expensive pee in America because we're all popping pills and vitamins and things of that sort. Lynn says too much vitamin D3 is bad. Yes, D3 is not water soluble, and I would check your vitamin D level to really determine if you need to supplement or not. Rather than popping a bunch of vitamin D, go out and get some sunlight, guys. Get a bit of sunlight every day, where you can get your vitamin D from, right? Rather than popping vitamin D pills, and you can take your walk at the same time with that. Now, in the few remaining minutes we have left, I want to chat with you about something that most of you have not heard before. It's called viral load. Does anyone know, for you guys who know what viral load means, what is the definition of viral load? What is the definition of viral load? Does anyone know what the definition of viral load? Elizabeth, the amount of virus. Absolutely correct. Yeah, excellent. Yes, you're right, Elizabeth. Viral load means the amount of virus that's in your system, amount of virus that's in your body, amount of virus that you have been exposed to. Okay, that's what viral load means, amount of virus that you've been exposed to or in your system. Now, we check viral loads all the time when in the office. If you have hepatitis C and I was treating you for hepatitis C, I would check your viral load. If you have HIV, I would check your HIV viral load to see if the medications is working. So we can check viral loads regularly with that. We can check all kinds of viral loads based on that. Now, real quick, guys, how many of you guys have already had a COVID test or know where to get COVID tests? Any of you guys know where to get COVID testing? CVS. Do they charge you at CVS? I'm going to show you two sites. Two sites where you can get free, no-cost COVID testing. I'm going to put in the chat box, Anaheim Convention Center or the OC Fairgrounds. No-cost COVID testing. It's a drive-through COVID testing. So you don't even get out of your car. And essentially, you can go to Anaheim Convention Center, OC Fairground. You have to RSVP online. You have to RSVP online ahead. Let me see if I can find the RSVP link for you guys here real quick and put it on there. Let me see here. Let's see if I can find the RSVP link for you guys to get COVID testing. Here it is. Okay. Now, you don't need to be insured at all. You can be uninsured and still get it. I just posted the RSVP link. It's 360clinic.md, 360clinic.md. They run the COVID test sites at the Orange County Fairground and also at the Anaheim Convention Center. For those of you guys who know friends, family, or yourself, and you need to know if you have COVID or not. They do not charge. They do ask that you bring insurance card. If you have insurance card, they'll try to bill your insurance and things of that sort, but they won't charge you personally. Make sense? So back to viral load in the last 5 minutes we got. Super cool. Viral load is the amount of viruses that's in your body, okay? Not that cool. But viral load is technology here. What we are learning is that patients who have a high viral load of coronavirus tend to be the sicker ones, tend to be the ones that die, tend to be the ones that are admitted to the ICU. High viral load, which means high amount of viruses in your body. Does that make sense to you guys so far? High viral load means you get sicker. Does that make sense? Okay, so viral load is how much virus is in your body, right? It depends on how strong your body can fight it to lower the viral load, or it also depends on the amount of viruses coming at you at the same time. High viral load means you're sicker. We have also found out that patients who are asymptomatic, those who don't have a lot of symptoms from COVID, have a low viral load in their system, a small amount of virus in their system. Okay, if you don't have a lot of virus, right, or if you have a low viral load, you're less sick. You're more likely to be asymptomatic. Low viral load. If you have a high viral load, you get much sicker. So this is something super practical for you. Viral load is the amount of viruses that you are exposed to. So, for example, if I'm not wearing a mask and Melissa's not wearing a mask, and Melissa has COVID, right? And we are, 2 feet apart, and Melissa is coughing at me. Go ahead and cough, Melissa.
I'm not a very good cougher.
You're not a good cougher. Right? Neither of us is wearing a mask. How much of that viral load of hers have I been exposed to, guys? How much of that viral load from her have I been exposed to? All of it. Right? Belinda says all of it. That's right, 100%. I've been exposed to all of her viruses as she is coughing at me without wearing a mask, right? And we weren't social distancing. Now, if Melissa is sick and she's not wearing a mask, but lo and behold, I'm wearing a mask, right? I'm wearing a mask. So let's say I'm wearing my, Walking Dead mask, the Walking Dead mask, right? And now Melissa is coughing at me, right? Go ahead and cough at me, Melissa. So Melissa's viral load is coming at me, but a lot of that stuff is protected here. I have cut down my viral load, her viral load exposure to me with the mask that I'm wearing. I'm cutting down the viral load exposure. Does that make sense to you guys? Type in yes if that makes sense. I'm cutting down viral load exposure. This is what this mask does. Now, do you have a mask with you, Melissa? Okay, wear your mask, Melissa.
Now, I always have a mask.
Now, Melissa's wearing a mask and she's got COVID, and I'm wearing a mask and I've got COVID, or I don't have COVID. Go ahead and cough at me, Melissa. How much viral load am I now getting from Melissa if she's wearing a mask and I'm wearing a mask? Right? So my point is, viral load is very important. If she's wearing a mask and she's coughing, a bunch of her sputum, which is in the droplets, right? The virus is in the droplets, right? As she's coughing, a bunch of it will be caught in her mask. And even if some of it comes outside her mask and I'm wearing my mask, at the same time, it's all about viral load exposure. Does that make sense to you guys today on the importance of why this little thing helps? If you understand viral load, right? If you understand viral load, this is what cuts down viral load exposure. How long does it last in the system? How much you get in your eyes? You probably a little bit, but it doesn't go to your eyes as much as this, okay? Right? All about mask wearing to cut down viral load. Nobody teaches viral load. All they say is wear a mask, right? But if you understand viral load, which is the amount of virus exposure you get exposed to, because if you're only exposed to this little bit of, right? If you're only exposed to this little bit of virus, and this little bit of virus, coronavirus, gets in there, your immune system can beat it up, right? If the bad guys are coming in and there's only 2-3 guys, your immune system will beat it up. But if I'm exposed to the full amount of viral load coming in because I'm not wearing a mask and somebody else who's sick is not wearing a mask, it overwhelms your immune system, and your immune system cannot fight adequately, which is why those folks are in the hospital at a higher rate, right? Or if you have a weak immune system, it's all about viral load, right? Cutting down your viral load exposure is my point. So how long does the virus live in the mask? A virus can live usually for a few hours on a mask. If you set your mask out and just let it sit out and dry out, usually you can rotate it every 3 days. Hopefully you don't have to do that. Hopefully you can just toss your mask, because they're like 40-50 cents now at the store, right? They're much cheaper. All about viral load, guys. Okay, what other questions do you have? What other questions do you have for me before we close it up here? Did you guys learn something today? Hope you learned something.
Unmuted. Hi.
Yes.
Hi, doctor. I just want to know if we get exposed to virus and if we get small amounts of virus over a long time, in the end, can it be accumulated to have a reasonably big viral load and get sick from that?
There's not a long-term accumulation that we are aware of, but we do know that families who live in the same household tend to catch it from each other. So it's that frequent exposure if you live in the same household. So we're seeing like entire families get infected all at once.
Right.
Yes.
Okay.
Yes.
So, Trinh,
Thank you.
how about Donald Trump? He has an immune system or not? He goes around and very active.
Yes, well, the president is alive and well. So that meant that his immune system fought it, along with the slew of medications they gave him in the hospital. Yes, it meant his immune system overcame it. Yes. Elizabeth says, what's the difference between a healthy immune response and cytokine storm in a person over 65? Yes, yes. To reduce your risk for cytokine storm, you reduce the inflammation that's in your body, right? Which is why it's so important to have a healthy, nutritious diet that is an anti-inflammatory diet. The higher your risk for inflammation, the higher the baseline inflammation you have, it's tougher because now you got more inflammation on top of baseline inflammation. Belinda says, can I quickly address the flu vaccine? Get the flu vaccine, guys, if you have not, unless there's a reason for you to not get it. But I would definitely get the flu vaccine. I've already got the flu vaccine with my family. We went to like Walgreens or somewhere like that. Because there's 2 viruses running around, you might as well try to reduce one virus, right? All right, guys, it's like 11:35. God bless. Thank you very much. We're going to record this, right, Melissa?
Yep, we have it recorded. I will send everyone an email today. It'll probably be up in hopefully a little bit less than a week. I'll send you the link where you can find it on our YouTube page. I'll also send you Dr. Trin's email if you didn't catch that in the chat box. So thanks everyone for being here today, and thank you, Dr. Trin.
God bless. See you guys later. Next chat.
Take care, everyone.
Bye-bye.
Bye.